Today we'll be discussing about colonic cancers. Colonic cancer means cancer developing the large bowel or large intestine. Usually colonic cancers, the age group is greater than 50 to 60 years, but nowadays they are increasing in the younger generations or younger groups also. What are the signs and symptoms of these colonic cancers? Usually they present with blood in stools or obstruction like symptoms where there is significant pain abdomen or vomiting or sometimes obstipation means not passing stools. Sometimes the patients can present with just anemia, that is blood loss of blood or decrease in the blood levels where they have evaluated. Then they will have the colonic cancers. The causes of these colonic cancers, one is family history. Usually, if you have a relative or the sibling or the mother father with those who have the colonic cancers at less than 45 years of age, maybe you are also having the colon cancers, or maybe you are the predisposition for the colonic cancers and you need to be screened before 45 years. Second thing, food habits, where you have intake of highly refined foods or red meat, then you will have increased colonic cancers. Smoking, alcohol, sometimes increasing colonic cancers. As such, age also is a risk factor for colonic cancers. The diagnosis of colonic cancers starts from the physical examination, where you can examine the patient, where you can palpate a mass, but it is very unusual because by the time it is very advanced. Or simple hemoglobin test, sometimes a aged person, aged male or female, where there is decreased hemoglobin, then you can suspect any of the cancers, but common is colonic cancers. To diagnose this, the gold standard is colonoscopy, where we pass a tube from the anus into the colon and we will check is there any masses or anything, and we will take biopsies and diagnose with histopathological examination so that we can confirm the type of the cancers we can have. Early detection of the colonic cancers is very important because the treatment and the prognosis changes when you detect any cancer in early condition, especially the colonic cancers. As already mentioned, if you are having a relative or the sibling or the mother father who are having colonic cancers, then you screen for colonic cancers. In India, there are no definitive protocols for screening of colonic cancers, but if you have crossing 50, you have any alarming signs, means you have increased diarrhea or constipation which of recent onset, maybe less than 1 month or 2 months, any blood in stools, any significant weight loss, any vomiting, then you need to undergo a colonoscopy and see for colonic cancers. The colonic cancer management nowadays is very advanced. If you diagnose the colonic cancers, if you are a candidate for a surgery and the tumor is not spread, then surgery is suffice or it completely cures the disease. If the cancer has spread into the around the walls of the colon, then you may need chemotherapy or radiotherapy. There is a good prognosis nowadays with this chemotherapy and radiotherapy for these colonic cancers. The best treatment modality is for the colonic cancers is screening or early detection of the colonic cancer.